Hello, Senator Cortez Masto. My name is Samantha, and my other colleagues are Sierra and Christine. And today we're here to talk to you about occupational therapy loan forgiveness when working with underserved populations here in Nevada. To start off, I wanted to talk about the average occupational therapy student loan debt here in the United States of America. On average, $180,000 in loans, with 1,300 graduating students each year, with a 6.8% interest rate. Myself, Sierra, and Christine are all currently attending Touro University, Nevada. Touro's mission is to provide social justice, intellectual pursuit, and service to humanity. Currently, Touro is the only accredited occupational therapy program here in the state of Nevada. The need for occupational therapy services throughout the Las Vegas and Henderson communities is evident, especially during the current pandemic. Touro's tuition alone is $120,000. And with tuition and the cost of living, it can range from $180,000 to $202,000. When you take into consideration the 6.8% interest rate, which adds up to about $137,360, you get a grand total of $339,360. I personally know I don't have that chunk of change hiding in my piggy bank. Senator, here are the facts. According to Student Loan Planner, the average OT they have worked with had about $180,000 in student loans. Many even ventured into the $200,000 plus range. AOTA, also known as the American Occupational Therapy Association, succeeded in getting occupational therapy recognized as a profession of national need, making occupational therapists who work with children, adolescents, and veterans eligible for additional loan forgiveness. The program would authorize loan forgiveness for up to $10,000 spread out over a 5-year period. Unfortunately, as you know, Congress never funded this program, so no loan forgiveness bills are currently available.
So, Senator Cortez, you must be wondering why occupational therapy and how occupational therapy have an impact on the community and why we are important to the healthcare community in general. Occupational therapy is a valued healthcare profession that focuses on restoring individuals' independence in their daily occupations. Daily occupations are everything that people do throughout the course of their day, from brushing their teeth and socializing with their peers. Simple things that we do every day from the morning till the nighttime that we go to sleep. We believe that high-demanding jobs should have loan forgiveness. There is a high need for occupational therapy services for underserved populations that occupational therapists works with on a daily basis. A few of these underserved areas are pediatrics, adolescents, mental health, rural areas, veterans, and low income. Pediatric occupational therapy helps children gain independence while also strengthening their development of fine motor skills, sensory motor skills, and visual motor skills that children need to function and socialize. While adolescents' physical, emotional, and cognitive barriers may interfere or limit their participation in desired occupations. Occupational therapists have this training and knowledge to assist the adolescents to reduce and overcome these barriers in life. Occupational therapy practitioners provide mental health treatment and prevention service for all ages and those with severe and persistent mental illnesses, with a focus on functional and independence for the future. Rural areas are often perceived to have limitations in healthcare resources overall. The literature indicates that shortages of occupational therapy resources exist within rural health areas due to the distance of isolated areas that are too far to be reached. Veterans occupational therapy helps veterans prevent health declines by maintaining their true daily health needs and show them how to continue to participate in activities that are important to them. As for low income, as healthcare providers, occupational therapy therapists often work with populations labeled as low income and must shift away from this prevalent understanding of poverty by viewing it within its wider context. As we can see here, Senator Cortez, this is a graphic that shows the percentages in underserved areas. For the school district population, there's only 19.9% of occupational therapists that are working in this area. As for early interventions in pediatrics, there's actually only 4.6%. Meanwhile, for mental health, it's the lowest one, and it has only 2.4%, and there is a growing need for occupational therapy in these underserved areas. So now here are some previous bills and legislations. There is the HEROES Act and the Student Loan Forgiveness for Frontline Health Workers Act. The HEROES Act requires the U.S. Treasury to make monthly payments on private student loans through September 30th, 2021, with total payments capped at $10,000 per borrower. The loans will be reported to the credit reporting agencies as though the payments have been made by the borrower. For Student Loan Forgiveness for Frontline Health Workers Act. This bill aims to provide student loan forgiveness to healthcare workers who are on the front lines in response to COVID-19. This loan forgiveness would be applied to any healthcare professional who is licensed, registered, or certified under federal or state law who provide COVID-related healthcare services. Similar to COVID-19, we feel that underserved areas should also have an opportunity to earn student loans forgiveness, as these occupational therapists are willing to serve in these areas that might not have the same coverage as a regular setting like a hospital or outpatient clinic. For their dedication and passion to work in these underserved areas, like the rural areas that might not have these occupational therapy services received due to COVID-19 or in other situations in general. It is only fair to ask for these occupational therapists to receive some of their loans to be forgiven to reduce the burden.
Occupational therapy practitioners working with underserved populations addresses the societal need of providing social and occupational justice to these communities and individuals in need. Social justice, according to Article 25 of the United Nations Universal Declaration of Human Rights, asserted that every member of society has the right to a standard of living that promotes health, including medical care and necessary social services. Occupational justice addresses equity, access, and the right to engage in one's desired or needed occupations. The following is a research article I found relevant to our proposal. It addresses how occupational therapists' involvement in federally qualified health centers, which are centers that provide healthcare to underserved areas and populations, may lower readmission rates, decrease overall healthcare costs for these individuals, improve health outcomes, and improve the experience of care through client-centered practice. We understand that with any proposal, there will be counter-arguments. We have identified 4 possible counter-arguments, and further research and planning will need to go into this topic to resolve them. The first counter-argument is, all occupational therapists serve individuals in need, so how can we differentiate between underserved populations from well-served populations? How can we decide which occupational therapist deserves loan forgiveness? What is justified? The next counter-argument is that there are irresponsible students who take out excessive loans that were not school-related. The following counter-argument is that it is unfair to fellow students or recent grad students who worked really hard to pay off their loans and better manage their finances. And the final counter-argument is that our income as occupational therapy practitioners is going to be higher than the average income in the United States. Therefore, it should offset the higher student loans. To address these counter-arguments, an underserved individual or population might present in different ways. They may be uninsured, homeless, or the facility or healthcare setting might have a shortage of practitioners. And while some students take out loans for additional expenses and do not manage their loans as well as others, these students will have to work longer with underserved populations or facilities in order to pay off their extra loans, which is beneficial for the underserved population. And while the income of the average occupational therapy practitioner is higher than the average income in America, this income range can vary greatly from setting to setting and by state and their living expenses associated with that state. For example, an OT who works in the school district in Nevada, which is an area where OTs are needed, may not make as much as a different setting such as a hospital. An OT who works in a rural area does not have the opportunity to see as many patients as an OT that has less travel time. There are many other professions offering loan forgiveness for employees who work with populations in high needs. Some examples include doctors and physicians, pharmacists, nurses, obstetricians, teachers, and social workers. For example, registered nurses who work in a public or private nonprofit critical shortage facility receive loan forgiveness. Additionally, teachers here in CCSD who work in a Title I or at-risk school also receive loan forgiveness. Senator Cortez Masto, we thank you for your time. We would love to schedule a follow-up meeting with you to further discuss the ongoing and pertinent need of loan forgiveness for occupational therapists who work with underserved populations. If you have any questions, you can email us at the emails listed below. Thank you so much for your time.